Imagine this. You're reaching for your morning coffee, and your fingertips feel like they belong to someone else. Numb. Tingling. Maybe your feet have been burning at night, like someone lit a match beneath your soles while you slept. You told yourself it was just aging, just tired legs, just cold hands. But what if I told you that strange sensation creeping through your fingers and toes right now is actually your nerves screaming for one single vitamin, a vitamin that nearly 40% of adults over 60 are dangerously low in? And what if I told you that catching it now, today, this week, could begin reversing that damage in as little as 14 days? Stay with me. This might be the most important health video you watch this year. Welcome back to the channel. If you're new here, we focus on practical, science-backed health information specifically for adults over 60 because your body has different needs now, and you deserve content that speaks directly to those needs. Today, we're talking about nerve health. Specifically, we're answering the question thousands of you have asked in comments and messages. What is the single best vitamin for protecting and repairing your nerves after age 60? Now, here's why this matters so much. Your nervous system is essentially the electrical wiring of your entire body. Every sensation you feel, every muscle you move, every organ that functions automatically while you sleep, all of it depends on healthy nerves. When those nerves start deteriorating, the consequences ripple through everything. Balance problems, difficulty walking, dropping things, pain that medications barely touch, even digestive issues and memory fog that get misdiagnosed as something else entirely. The tragedy is that millions of seniors suffer from nerve damage that could have been prevented or even reversed with one targeted nutritional intervention. So let's get into it. The number one best vitamin for nerve health after 60 is vitamin B12, also called cobalamin. And before you think, oh, I've heard of that, I probably get enough, let me explain why that assumption is exactly what gets so many people into trouble. Vitamin B12 does something no other vitamin in your body can do quite as well. It builds and maintains the myelin sheath. Think of myelin like the rubber insulation wrapped around electrical wires in your house. Without that insulation, the wires short circuit. Sparks fly. Signals get scrambled or lost entirely. That's precisely what happens inside your body when B12 levels drop too low. The protective coating around your nerve fibers starts thinning, fraying, breaking apart. Nerve signals that should travel smoothly from your brain to your toes begin misfiring. The result? Numbness, tingling, burning pain, weakness in your legs, difficulty with coordination. Here's the critical part that most people don't understand. After age 60, your body's ability to absorb B12 from food drops dramatically. Your stomach produces less hydrochloric acid. That's the acid needed to separate B12 from the proteins in meat, fish, and eggs. You could eat a steak dinner every single night and still become deficient. It's not about what you eat. It's about what your aging digestive system can actually extract and use. Studies published in the American Journal of Clinical Nutrition found that up to 38% of older adults have serum B12 levels in the low normal or deficient range. Low normal. That phrase hides a dangerous truth because neurological damage from B12 deficiency can begin long before your blood test officially reads deficient. Your doctor might look at your results, say everything appears fine, and send you home while your nerves continue deteriorating quietly in the background. Let me ask you something. Have you noticed any tingling in your hands or feet lately? Any unusual clumsiness? Moments where your balance felt suddenly unreliable? Hold that thought, because we're going to talk about the full list of warning signs in just a moment. Many seniors ignore these signs because they assume it's just normal aging. It's not. Normal aging does not make your feet burn at 3 in the morning. Normal aging does not make your hands so numb you can't button your shirt. These are signals, your body communicating that something specific has gone wrong. Here are the warning signs of B12-related nerve damage that every person over 60 should recognize. Peripheral tingling and numbness. This usually starts in the feet and hands, what doctors call a stocking and glove pattern. It might feel like pins and needles that never fully go away. Some people describe it as wearing invisible gloves or walking on cotton balls. The sensation feels muted, distant, wrong. Burning or electric shock sensations, particularly at night when you're lying still. Your nerves, stripped of their protective myelin coating, fire randomly, pain without cause, heat without source. Many people get prescribed pain medications for this without anyone checking their B12 status first. Balance and coordination problems. B12 deficiency damages the nerves that communicate proprioception, your body's internal sense of where your limbs are in space. You might stumble more, misjudge a step, feel unsteady on uneven ground. Falls among seniors increase significantly with untreated B12 deficiency, and we all know how devastating a fall can be after 60. Muscle weakness, especially in the legs. Walking shorter distances, feeling heavy, difficulty rising from a chair without using your arms. The nerve signals reaching your muscles grow weaker, and the muscles respond accordingly. Cognitive fog and memory lapses. This one scares people the most because they immediately think of dementia. And here's what's heartbreaking. Some seniors have been misdiagnosed with early Alzheimer's disease when the actual culprit was profound B12 deficiency. Once treated, their cognition improved. Imagine living with that misdiagnosis for months or years when the solution was a vitamin. Mood changes, depression, irritability, anxiety. Your brain requires B12 to produce neurotransmitters like serotonin and dopamine. Without adequate supply, mood regulation falters. Many older adults end up on antidepressants when a nutritional deficiency is fueling their low mood. Digestive issues. Constipation, loss of appetite, weight loss. The nerves governing your digestive tract need B12 just as much as the ones in your fingertips. If you recognized yourself in 2 or more of those signs, please don't brush it aside. Write them down, bring them to your next appointment, and keep watching, because I'm about to show you exactly how to fix this. Let me paint a clearer picture of why this deficiency hits so hard after 60. First, stomach acid declines. Medical literature calls it atrophic gastritis, a thinning of the stomach lining that reduces acid production. By age 60, roughly 30% of adults have some degree of this condition. By 70, that number climbs higher. Less acid means less B12 liberated from food. Simple as that. Second, medications. This is one that almost nobody talks about openly. Metformin, the most commonly prescribed diabetes medication worldwide, is proven to reduce B12 absorption. Proton pump inhibitors, those acid reflux medications like omeprazole and lansoprazole that millions of seniors take daily, also slash B12 absorption significantly. H2 blockers like ranitidine do the same. If you take any of these medications regularly, your risk of B12 deficiency multiplies. Third, dietary patterns shift with age. Appetite decreases. Dental problems make chewing meat difficult. Some seniors move towards simpler, softer foods, toast, soup, crackers, that contain virtually no B12. Those following vegetarian or vegan diets are at even greater risk since B12 occurs naturally almost exclusively in animal products. Fourth, and this one surprises people, surgery. If you've ever had gastrointestinal surgery, particularly anything involving the stomach or ileum, the lower portion of your small intestine where B12 is absorbed, your absorption capacity may be permanently reduced. If you're over 60 or caring for an elderly loved one, this information could genuinely change the trajectory of someone's health. Consider sharing this video with a family member or friend who might benefit. Sometimes the people closest to us need someone else to point out what they've been dismissing. Now the part you've been waiting for. How do you actually fix this? And can you really feel improvement in 14 days? The answer depends on how severe your deficiency is and which form of supplementation you choose. But yes, clinical evidence supports that many people begin noticing reduced tingling, improved energy, and better sensation within 1 to 2 weeks of proper B12 repletion. Full nerve repair takes longer, sometimes months, but that initial relief comes faster than most expect. Here's your action plan, broken into clear steps. Step 1. Get tested properly. Ask your doctor for a serum B12 test, but also request methylmalonic acid and homocysteine levels. These markers catch functional B12 deficiency, situations where your blood B12 appears adequate, but your cells aren't actually using it effectively. Many experts now consider optimal B12 levels to be above 500 picograms per milliliter, not merely above the outdated lower cutoff of 200 that some labs still use. Step 2. Choose the right form. Not all B12 supplements are equal. Methylcobalamin is the active, nerve-friendly form your body can use immediately without conversion. Cyanocobalamin, the cheaper, more common supplement form, requires your body to convert it first, and that conversion becomes less efficient with age. Look specifically for methylcobalamin on the label. Step 3. Choose the right delivery method. If your stomach acid is low or you take acid-reducing medications, swallowing a B12 pill may accomplish very little because the absorption problem starts in your gut. Sublingual tablets, the kind you dissolve under your tongue, bypass stomach absorption entirely. The B12 enters your bloodstream directly through the tissue beneath your tongue. For moderate to severe deficiency, many doctors recommend B12 injections initially, then transitioning to high-dose sublingual maintenance. Step 4. Dosing for the 14-day repletion phase. Clinical protocols for B12 deficiency often start with 1,000 to 2,000 micrograms of sublingual methylcobalamin daily. Some physicians recommend 2,500 micrograms for the first 2 weeks to rapidly restore nerve tissue levels. B12 is water-soluble. Excess amounts pass harmlessly through urine, so toxicity risk is essentially non-existent even at higher doses. However, always confirm dosing with your healthcare provider, especially if you take other medications. Step 5. Support absorption with cofactors. B12 works alongside other nutrients. Folate, vitamin B9, partners with B12 in nerve repair pathways. A B-complex supplement that includes methylfolate, B6, and B12 together often produces better neurological outcomes than B12 alone. Additionally, ensuring adequate vitamin D and magnesium supports overall nerve signal transmission. Step 6. Dietary reinforcement. While supplementation handles the heavy lifting, adding B12-rich foods strengthens your baseline. Clams and mussels contain astronomically high B12 levels. Just 3 ounces of cooked clams provide over 1,000% of the daily recommendation. Sardines, salmon, trout, eggs, and fortified nutritional yeast all contribute meaningfully. Liver, if you enjoy it, remains one of the most concentrated natural sources. Step 7. Track your progress. Keep a simple journal during your 14-day repletion. Note your tingling levels each morning on a scale of 1 to 10. Record your energy, your balance, confidence, your sleep quality. After 14 days, compare. Many people reviewing their notes realize improvement happened gradually, so gradually they might have missed it without writing things down. Now, I want to set realistic expectations. If nerve damage has been progressing untreated for years, 14 days will not completely reverse everything. Myelin regeneration is a biological process that takes time, sometimes 3 to 6 months for significant structural repair. The 14-day window represents the period when most people first notice symptomatic relief. Less burning, fewer pins and needles episodes, slightly better sensation in fingertips or toes. That early improvement signals that your body is responding, that healing has begun. For severe or long-standing deficiency, some nerve damage may become permanent. This is exactly why catching it early matters so profoundly. Every day you wait is a day your nerves continue fraying without the raw material needed to rebuild. B12 supplementation creates the foundation. These additional strategies accelerate the repair process. Movement. Gentle daily walking, even 15 minutes, improves blood flow to peripheral nerves, delivering oxygen and nutrients to damaged tissue. Nerve fibers that receive consistent blood supply regenerate faster. If balance is currently compromised, use a walking stick or walk along a hallway wall for support. Chair exercises offer an alternative when standing feels unsafe. Blood sugar management. Elevated blood sugar damages nerves independently of B12 status. If you have prediabetes or type 2 diabetes, controlling glucose levels through diet, medication, or both dramatically improves the environment in which your nerves are trying to heal. Combining B12 supplementation with tight blood sugar control often produces results neither intervention achieves alone. Sleep quality. Nerve repair happens most actively during deep sleep stages. Establishing consistent sleep timing, reducing screen light in the evening, and keeping your bedroom cool all support the restorative sleep cycles your nervous system requires for rebuilding. Reduce alcohol intake. Alcohol is directly neurotoxic. It poisons nerve fibers and simultaneously depletes B12 stores. Even moderate drinking slows nerve recovery. During your 14-day repletion phase and beyond, minimizing alcohol gives your nerves their best chance. Stress reduction. Chronic stress elevates cortisol, which increases inflammation around nerve tissue. Whatever calms your particular nervous system, prayer, gardening, gentle music, time with a pet, incorporate it deliberately. Please see a doctor promptly if you experience any of the following: sudden onset of numbness or weakness on one side of the body. That's a stroke warning, not a vitamin issue. Rapidly progressing weakness in both legs, loss of bladder or bowel control alongside back pain, complete loss of sensation in any area. These require emergency evaluation. For B12-related nerve concerns specifically, request a referral to a neurologist if your symptoms haven't improved after 4 to 6 weeks of proper supplementation, or if weakness is progressing despite treatment. Additional testing, nerve conduction studies, or electromyography can determine the extent of damage and guide further intervention. Let's bring this together. Your nerves are not disposable. They are not an acceptable casualty of aging. The numbness in your feet, the tingling in your hands, the burning that wakes you at night, these symptoms carry a message, and that message is often remarkably simple. Your body needs B12. After 60, absorption declines. Medications interfere. Dietary intake drops. The perfect storm converges silently until one morning you realize you can't feel the floor beneath your feet properly, and you wonder how long it's been that way. Methylcobalamin supplementation, sublingual or injected, can begin restoring what's been lost. 14 days to feel the first shift. 3 to 6 months for deeper structural repair. Combined with movement, proper nutrition, sleep, and blood sugar awareness, you give your nervous system every possible advantage. You are not too old to heal. Your nerves retain the capacity to regenerate. Biology supports it. The research confirms it. The only variable left is whether you act on this information today or let another week, another month, another year pass while those nerve fibers continue thinning in the dark. Choose today. If this video helped you understand something about your body that no one had explained clearly before, hit that subscribe button. We release new senior health content weekly. Always research-backed, always practical, always designed for real life after 60. Share this video with someone you love who's been complaining about numbness or tingling. You might hand them the answer they've been searching for. And drop a comment below telling me, have you experienced any of these nerve symptoms? I read every single one, and your story might help someone else recognize what's happening in their own body. Take care of yourselves. Your health is worth fighting for at every age. I'll see you in the next video.